This video is going to talk to you about the use of epidural for childbirth and for coping during the birth process. Epidural is only something that we can offer in a hospital setting, so it wouldn't be an option available to you if you were choosing to have a home birth. The epidural is sited by one of our anaesthetists who are highly skilled in doing this. There is an anaesthetist on call for us 24 hours a day on delivery suite. So typically at the point of asking for one, we are able to provide the service. There may be a short wait if the anaesthetist is dealing with another lady, perhaps a lady who is needing to have an unplanned cesarean and needing to go to theatre. Then that lady would need to be their priority. So there may be a short wait and you may need to consider other options if you feel that you need something to help you manage. The anaesthetist will want to understand that you're giving your informed consent to the epidural. So they will ask you to read through an epidural information card beforehand. So if you ask for an epidural, the midwife will give you one of these little cards to read. Hopefully you can see that there's quite a lot of information on those cards, and that could be quite a lot to process. Imagine if your contractions were coming every other minute. You may choose that your birth partner reads this information to you between your contractions, but it's really important to listen and to understand what you have asked for. Epidural does carry small risks, albeit very small risks. The commonest is about a 1 in 50 chance of your blood pressure dropping, which can make you feel quite dizzy and lightheaded. Before we start the epidural, we would ask to pop a little cannula into the back of your hand, and this is a means of being able to give you any fluids quickly to bring your blood pressure up, or to give you any medication if we needed to. So once you've asked for an epidural and the epidural information card has been read, the anaesthetist will then have a chat to you and then be in a position to start the procedure. Just to give you a little bit of an idea as to how commonly they're used, in 2019, just over 22% of women who chose to birth at Harrogate chose to have an epidural at some point during their birth. But the choice is yours and it's driven purely by that, okay? It's really important that we get your position right to get the epidural sited successfully. So the midwife and the anaesthetist will support you to work between your contractions to get into a good position. I'm just going to turn sideways on to help you understand this. So we'll ask you to sit on the side of the bed and to drop your shoulders down and to slump almost, and to kind of roll forward, usually with a pillow in the front of your bump to help you kind of get that position of rolling forward. What that position does is open up all the spaces between the spine bones so we can find the right place to site the epidural. If your contractions are coming really regularly, again, we will work with you. So we might get so far and then just have a break while you have the contraction. It might be that you choose to use a little bit of gas and air to help you with the process of keeping that little bit comfier whilst we get the epidural in. It's a clean aseptic procedure, so we would need to have a sterile drape on your back, and we would give a good clean down first. The anaesthetist would need to scrub up and to make sure that they're clean for the procedure too. The actual siting of the epidural could take 15 to 30 minutes, and then another 15 to 30 minutes for the medication to get in and to get working. We give some local anaesthetic into the skin first to numb, and that sometimes ladies describe as feeling like a bee sting. Once that local anaesthetic has taken place, then the anaesthetist will be having a really good feel of your back to find the right place to put the epidural. Once they've found the right place, they will use a needle to push through all the different layers of your skin and the muscles and fat layer and into the right epidural space. What you may feel during that time is a little bit of pressure or some tugging, and that is really, really normal. If you're finding it uncomfy and you're feeling sharp, then let us know. We can just stop and possibly give you a little more local anaesthetic to help that process feel comfier. Once the anaesthetist has identified the correct space, the little epidural catheter is then fed down the needle. Perhaps you can't see this very clearly to the camera, but you can see actually how thin that piece of plastic is, and that's all it is. It's a piece of plastic. It's literally 1 millimetre or 2 thick. That epidural catheter gets fed down the needle, and then the needle comes out of your back. So there's no needle that's staying in there, it's just this piece of plastic. The epidural then comes and attaches to the front of your nightie, or if you're wearing a hospital gown, and then that attaches to the pump, and it's the pump that will deliver your medication. The medication is a mix of some strong local anaesthetic and some pain relieving drug as well. And the pump delivers a continuous dose to help you feel comfortable. The one downside of the epidural is that it really is going to limit active birth, so you will be confined to the bed. What the midwife will encourage you to do is to change position regularly, so she will support you to perhaps turn onto one side or onto the other. We've also got some special wedges that we can use to give you to put in between your knees, in between your legs, and that helps to widen that pelvic ligament at the front of the pelvis, and again helps to maximize some space to make the passage of baby easier. Sometimes the epidural can drop your blood pressure very quickly. There's about a 1 in 50 chance of that happening. If that does happen, we will give you some fluids quickly through the cannula. There's also other risks of epidural, and these are very clearly documented on the information card that you'll be asked to read. Again, all very small risks, but it's important that you understand those. Having an epidural doesn't mean that you will definitely need a handout with your baby. It does ever so slightly increase the need to perhaps give baby a handout at the end with forceps or von-2s. It doesn't increase the risk of needing cesarean section. But please be reassured that there are plenty of women who have beautiful vaginal births with an epidural. Okay. We may monitor your baby for a short period of time using the CTG as the epidural first goes in. So it's 2 belts that go around your abdomen, one that listens for baby's heart rate, the other one that picks up your contraction pattern. If all's okay after a period of around 30 minutes, then it's likely we can discontinue that monitoring. If we need to continue for any reason, then the midwife will explain her rationale for you. The epidural continues until your baby's born, so it keeps on coming through this catheter, and we turn the epidural off once your baby's born and once the placenta has delivered. And if you did happen to need any stitches into the perineum, again, the epidural would keep on running until that had finished.